Radial nerve. It is the longest branch of posterior cord of the brachial plexus. Root value of radial nerve is C5 to C8 and T1. Radial nerve is run behind the third part of the axillary artery. In the arm, it runs posteriorly to the brachial artery. Soon it enters the radial groove on the back of the arm, where it accompanied by the profunda brachii artery. It reaches the lateral side of the arm. It appears and runs in front of the arm, where it lies between the brachialis muscle medially and brachioradialis and extensor carpi radialis longus laterally. Then its branches. First, muscular branches in the arm. Before entering the spiral groove, it supplies the long and medial head of triceps brachii. In the groove, it supplies the lateral and medial head of the triceps brachii, and below the groove, it supplies the brachialis, brachioradialis, and extensor carpi radialis longus muscles. Cutaneous branches in the arm are above the groove. It gives off posterior cutaneous nerve of arm, which supplies the back of the arm. In the groove, it gives off lower lateral cutaneous nerve of arm and posterior cutaneous nerve of forearm. Then applied of radial nerve in the arm region. Radial nerve is commonly injured in the radial groove. Causes of injury: Saturday night palsy and crust paralysis, fracture of shaft of the humerus. This result in wrist drop and sensory loss of the brachii of the forearm and laterally side of the dorsum of the hand. Wrist drop quite disability become because of the patient cannot grip anything firmly in the hand without action of extensor. In the forearm, the radial nerve has two divisions: superficial, purely cutaneous, and run along the radial artery, and damage cause loss of sensation around the thumb. Deep or posterior interosseous branch. It pierces the supinator muscle and reaches the back of the forearm and lies between the superficial and deep muscle of extensor muscle of forearm. Branches of radial artery in the forearm. First, muscular branches. Before piercing the supinator, it supplies the extensor carpi radialis, brevis, and supinator muscles. After emerging from supinator, it gives three short branches to extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris, and two long branches of radial artery in forearm. Lateral branches supplies the abductor pollicis longus and extensor pollicis brevis, and medial branches supplies extensor pollicis longus and extensor indicis.